Exercise and lupus. Recommendations for physical activity and exercise in persons living with systemic lupus erythematosus, or SLE, consensus by an international task force. That sounds super impressive, and it actually is super impressive. So what they've done is they've got loads of people that know lots and lots and lots about lupus and exercise and stuff. And what they've done is they've talked about lupus and exercise and physical activity a lot, and they've come up with some guidelines and advice. And what I'm going to do is I'm basically going to go through that, and hopefully we'll pick out the components that are really useful for us. This video is a combination type video. Really, it's a lot of my thoughts around this research paper. I'm going to put the full link in the description, so you can go and read the whole thing if you want to. It is open access in the Journal of Rheumatic and Musculoskeletal Diseases, so you can go and read the whole thing. But I'm going to give you my thoughts on this, and we're going to get into the bits that are specific and that we can use really nicely. They obviously talk about future research and all that kind of thing, which is really interesting to read, but not the kind of bits I'm going to pull out in this. So I'm going to butcher some names here, unfortunately, but this is a paper by J. Blass, Blaess, Blaess, Genoton, S. Genoton, and T. Gopfert et al. And the long bit was the title of the paper. There are lots of other authors on here as well. About how many of them is there? 2, 4, 6, 8, 20-ish. So hopefully that's really interesting. So the first thing I want to do is this is talking about lupus, obviously, and the physical activity, exercise guidelines and principles, and how people with lupus might go about doing that and optimizing it specifically for that population. So there is some interesting information in here that could be a bit more generalized to other inflammatory diseases, especially connective tissue disorders, things like Sjogren's disease. But just to point that out, we are specifically talking about SLE here. And just to get us started, they have actually defined what they're talking about when they say physical activity and exercise. So just going to go through that to begin with so that we all know, we're all on the same page, what exactly we're saying about when I say physical activity, when I say exercise, what those things mean. And what they've said here is that they are often used interchangeably, but represent distinct concepts with subtle differences. Physical activity is anything which gets heart rate up, is of a physical challenge of some kind. And exercise fits within that. So exercise is a type of physical activity, but it has some intentionality to it and a structured nature. So, for example, physical activity might be lifting heavy things around the shopping center, lifting up the heavy shopping bags, as opposed to a exercise, which might be the same movement. So you might be lifting something, but it's a weight and you do it in a certain number of repetitions, certain number of sets. So there's a bit more purpose to it. It's a bit more planned. So that's where they've gone with this distinction here. And I think, that's fairly okay with me. I have no major issues there. So the first thing that they've done is they've created 3 overarching principles, and then we are going to go on and talk about some more specifics as well. So the 3 overarching principles, they've actually labeled A, B, and C. So A, I'm going to just read this out here. So A, the overarching principle is the first one. The decision to engage in physical activity and exercise should be the result of a shared decision between persons living with SLE and their physician. And I'm going to add a healthcare professional in there. So physiotherapist, MSK therapist, whatever, is in there. So basically what's going on in this principle here is they're saying that it certainly shouldn't be dictated to the individual with SLE that they must do this physical activity and exercise, and they have to do it whether they want to or not. It's an exploration and a shared decision where you come to that together. And that's going to come out a little bit in the specifics later as well as to what kinds of exercise or what kind of physical activities get chosen. Overarching principle B, I want to say number 2, but it's not, it's B. The expected benefits of physical activity and exercise should be explained to persons living with SLE. That's fairly self-explanatory. Why do you want to do the exercise? What are you going to get out of it? And then C, overarching principle C, the absence of contraindications to physical activity and exercise should be communicated to other healthcare providers of persons living with SLE, e.g. doctor, nurse, physiotherapist. So if the rheumatologist is probably going to be the main person doing this, if the rheumatologist decides there aren't contraindications to physical activity and exercise in this individual, then they must go on and tell the other people involved in their care that is the case, and to try and encourage this communication across the board that physical activity and exercise is going to be of some benefit to those people. So about tying up this communication and making sure it comes across the board. And I quite like that as an overarching principle. I think that's pretty good thing to be doing anyway. So really, really like that. So those are their 3 overarching principles. I don't know if anybody's going to disagree with that. I think they're fairly sensible. You know, can't bully people into exercise, and I'm fairly sure people with SLE don't want to be bullied into exercise, and then they want to know the benefits and also communicating all of that across the people that are involved in the healthcare system, working with those people with SLE. So, you know, fairly sensible decisions there. I just want to go on to a little bit here. The next part of this paper, they've got a short part about expected benefits here. And I agree with this pretty much is with what they've said here is common barriers to physical activity in these people are previous negative experiences, sedentary lifestyle and lack of previous experience being physically active. And this, again, you know, SLE starts usually at a pretty young age. Between 16 and 30 is really common. So what happens is they get this persistent pain, or they get these widespread symptoms, and they never get into exercise-based habits. So that can be problematic when they're either a little bit older or they want to start. They've just never had that baseline to get there. So benefits, really, they show improvements in aerobic capacity, limb function, grip, pinch, strength, which you wouldn't be surprised. You know, if you do more gripping, you do some strengthening exercises, those things are going to improve. Do cardiovascular exercises, your cardiovascular system is probably going to improve. No, again, not surprising. The key one, I think, here that they've mentioned is an improvement in fatigue. And this, to me, is the biggest barrier I've ever had to work with people with lupus, is their significant fatigue. And then, of course, we were asking them to do more, specifically tiring exercises, and that can increase their fatigue, certainly in the short term. But we know from research, actually, that in the long term, their fatigue will decrease. So you do have to have a bit of an acceptance of this sort of short-term fatigue increase with the long-term benefit involved. And it seems counterintuitive that doing more means less fatigue. But when you do these specific, remember the intentionality of these exercises, this is where we're going to see this improved levels of fatigue over the longer term. So when I'm talking about this with patients with lupus, I'm breaking this really into 3 categories. There's what I would call general health benefits. So we know being physically active and doing exercise is generally good for you. It's good for bone strength, good for muscle strength, good for cardiovascular fitness. It's good for basically all cause what we'd call mortality. So anything that might shorten someone's life tends to be improved by exercise. So that would be component number 1. Component number 2 would be function. So literal things that people need to do, getting up and down the stairs, gripping things, holding things, carrying things, walking certain distances, running, occupational activities like work. So that would be the second category where we're intervening and doing something specific for those functions. And then 3 would be the fatigue management side of things from a lupus point of view. And so you have to adapt and explain in different categories why we're trying to intervene in this way for the individuals. So I tend to go through those 3 sections with each individual, and obviously some will apply more than others to different people. So you might have someone with lots of fatigue or someone with no fatigue. You might have someone with lots of functional difficulties, no fatigue, no functional difficulties. And usually they come with a combination of the 3. So there's a bit of a mixed bag picture between the 3 of those components. Obviously it's a little bit more complicated than that, but that's broadly how I manage that. So let's get into their recommendations, their specific recommendations. And there's actually 15 of these. Some of them we'll talk a little bit more about than others. Number one, for example, these are evaluations by specialists if they have osteonecrosis or Jacob's syndrome. And I don't actually know what Jacob's syndrome is, so I need to go and look that up. I might have to do another video or something on that, but I don't know what Jacob's syndrome is. Need to go investigate that. Osteonecrosis is problems affecting bone, so you get bone death. Essentially, is what that means. But in those cases, they need to be evaluated by specialists prior to starting any physical activities. So we're not going to spend too much time on that. That's only going to affect, obviously, people with those kinds of diagnoses. So let's get into the meaty stuff. There's some good recommendations here. And number two might sound like a little bit of an odd one. So this one, in case of outdoor activity, adapted measures such as photo protection are necessary and use of adequate clothing against the cold is recommended. So there's two components, obviously, here. We've got photo protection, so that's protection against the sun. And this is due to photoreactive rashes, which are common in SLE, across the top of the chest, across the face. And we want to try and reduce those down. So you may well be that if people are going outside to do their activity, they either need sunblock or they need to be covered. Covered, obviously, top or a hat or something. And if you have specific types of sport clothing, you'll note that some of them state SPF 50 on the clothing. So you might need to adapt that, especially if someone has a very reactive to sunlight rash. We want to get involved in that. So it's something that we need to consider. And then against the cold, is because Raynaud's phenomenon is so common in our SLE patients, in lupus patients. It's very highly prevalent and it's very uncomfortable and not very nice. So we need to make sure that they've got warm gloves and warm socks to make sure they're not getting this Raynaud's phenomenon flare up in their hands and feet. So there's the first thing to consider across from this paper. Number three, physical activities at high risk of trauma should be performed with caution in persons with SLE using anticoagulants and so, if you're on blood thinning medications, try not to fall over is basically what that's saying. So 5, during articular flares, we recommend avoiding involving inflamed joints during physical activity and exercise. And combine this with number 4, in case of a lupus flare, potential contraindication to physical activity and exercise should be reassessed. So what we've got here is we've got two components of a flare-up. So generalized lupus symptoms flare-ups might be a contraindication, and we should probably be reassessing that person. I would suggest the rheumatologist does that. So that's going to include the skin symptoms, the muscles and joint pains, and any other organ involvement. If those are flaring generally, then we want the rheumatologist to be assessing what's going on prior to certainly starting physical activity or exercise programs, but maybe even continuing. And then specifically the articular flares. So if you've got a joint that's flaring up, they're recommending avoiding involving the inflamed joint during the physical activity and exercise. So, for example, if that's your foot, then you might just do upper limb exercise, or you might go to the pool, or if it's your hand, you might do just leg exercises. You just avoid doing that. And to be honest, sometimes that's a little bit easier said than done, especially depending on the number of joints involved. But if it is multiple joints, then maybe we're getting into that previous part where it's more of a generalized flare-up. So it's a little bit difficult to manage this, straddle that line. But to me as well, I do recommend this. Avoidance, I struggle with that a little bit. I tend to reduce down either the load or the repetitions for the person with that exercise if they then tolerate it. Depends on the significance of how bad that flare is really on the individual and what their tolerance level is. So definitely pay some consideration to that. And if you're a person with SLE, then just keep an eye on what your joints are doing and what exercises you're doing and whether they are particularly aggravated at the time. You might want to reduce down what you're doing with that exercise. So 6, physical activity is recommended. And that, I think, is recommended for everybody on the planet pretty much. So that's fairly obvious. And the usual recommendations, they do vary place to place, somewhere between about 150 and 300 minutes per week of moderate intensity exercise or physical activity. And then following up from that, number 7, baseline level of physical activity should be assessed. That's fairly easy and obvious. This one suggests using dedicated questionnaires or the number of steps per day. And obviously you want a baseline level so you can work on whether you're increasing it. People are, if you ask me how many steps I do a day, I've no idea. So we need a baseline so we can work with that. Number 8, implementation of physical activity should be adapted in terms of frequency and intensity for each individual. Again, pretty much sure we should do that for every exercise program on the planet. You wouldn't give everybody the same exercise program. That's fairly obvious. If you had Usain Bolt and then you had me, you wouldn't give us the same exercise programs. He's probably a little bit less fit than I am, so you want to tail it back for him, and I'm obviously going to be working a little bit harder. But you seriously, take the individual. This is where the baseline level comes in. Take the individual, what they're already doing, what their capability is, and then adapt a physical activity program specifically for them. 9, unless otherwise indicated, all persons with SLE with inactive disease or mild disease activity should gradually reach the recommendations, which is about 150, as we mentioned, 300 minutes per week of moderate intensity exercise, and covering that over at least 2 days. So again, we're mentioning, coming back to that, so this goes from the baseline. If someone's already at that level, then for the physical activity, then great. If they're not, then obviously we're not going to go, you need to do this specific amount of exercise right now. We're going to build them up so they can reach that tolerance level. Lovely stuff. So again, if you are someone with lupus, then you want to be taking a baseline of what your exercise levels or your physical activity levels are. They suggested, steps per day is not a bad start. And also timing how long you think you're in a moderate intensity exercise per week. And if you're not quite there, then what we're going to be doing is we're looking at increasing that up to the 150 minutes moderate exercise. Or if you want to increase your physical activity, then obviously from that baseline number of steps, you're going to increase or aim to increase. Do that quite slowly over time. Okay, so we can continue with the recommendation statements here. Number 10, a medical evaluation should be performed before starting exercise in order to identify potential contraindications and allow for personalized adaptations and preferences. And again, that doesn't necessarily need to be done by the rheumatologist or the doctor. A physiotherapist could do that, or a MSK therapist, but just making sure that we're getting a general medical evaluation to make sure people are well, but also so that they get to their recommended tolerance level, really, or their personalized tolerance level. So they're not trying to just smash them straight out of the gate, build them up nice and slowly. Number 11, for better personalization, exercise programs should be supervised by a qualified professional, physiotherapists or professionals trained in adapted physical activity. So again, people that are here or watching who might have lupus, then you can run your own exercise program, but it's a bit difficult to personalize your own exercise program unless you have some sort of skill set in it. But if you are looking for a professional, then you want one who has knowledge or the skill set in adapted physical activity. So basically people who work with long-term conditions, and even better, someone who knows about lupus. 12, implementation of exercise should be gradual and adapting the frequency and intensity to the individual's capacity and comorbidity. So again, this speaks back to what we've already been talking about. We're going to gradually increase the amount of exercise. It's not from 0 to 5 days a week. It's gradually building up both the duration and the intensity to get towards those recommended amounts. Then we're going to get into some real specifics here. Now, this speaks to this personalization, but this is the first time I've really seen this. This is real specifics in these recommendations. So 13, 14, and 15, these do get very specific here. So this is number 13, each exercise session should start with a warm-up at low to moderate intensity exercise and should end with a cooling down period. including stretching. How that's done, that's going to be individual. Just, don't, I suppose it's just suggesting don't go from sitting on the sofa to a full sprint, build up that little bit and then cool down afterwards. How you go about that, how that's done, I'm not going to comment specifically here, but exercise professional should be able to help you with that. Exercise programs is number 14. Sorry, I keep skipping the numbers. Number 14. Exercise programs should be performed in 3 to 5 sessions each week and include both aerobic and resistance training exercises. And again, this talks to the generalization of the exercise program. So it's hitting those 3 core components that we talked about: the function, the general health benefits, and the fatigue. But also you're not just killing yourself in one session, but splitting those up over 3 to 5 sessions. And this kind of speaks to the effectiveness of exercise programs, really. And then finally, 15, resistance training should be performed for 1 to 3 sets per exercise with 8 to 12 repetitions using rest periods of 1 to 3 minutes. That's fairly standard exercise prescription numbers. But again, we're going to individualize those. So again, if you're a person with lupus and you want an idea of how much to do, that's not a bad starting point. So let's take an exercise, let's say squats. So if you're doing resistance training, a squat would be included in that. So you're going to do 1 to 3 sets, so of 8 to 12 repetitions. So let's think about starting. You're going to do 1 set, probably of 8 repetitions, and then build that up slowly over time. And you can do that in either way. You can either increase the number of sets or you can increase the number of repetitions. I wouldn't do both at the same time, but you're going to go let's say 1 set of 8, then you might go to 1 set of 12, then you might go to 2 sets of 8, 2 sets of 12, 3 sets of 8, 3 sets of 12, for example. And then if you're doing 3 sets of 12 and you're finding that relatively easy, you need to be adding weight to that to make it more difficult. And including rest periods of 1 to 3 minutes. So you're not leaving ages between each set, but also you're leaving yourself some rest period as well. So it's a good way to start. People who are a bit more familiar with exercise or already doing exercise programs or have a much higher ability, then that can be changed as well. And again, an exercise professional should be able to help you with that quite nicely. So those are the recommendations created by this paper. Again, like I said, I think I pretty much agree. I mean, maybe not quite 100%, but certainly a 99% there it's really good, a really good starting position. I think a lot of people with lupus, a lot of healthcare professionals treating people with lupus are concerned about prescribing exercise, don't know where to begin. This gives us a really nice position to start from. It also gives us some really specific recommendations. So if you are a person with lupus, I think you can use this to begin an exercise program, see how you get on and be fairly confident you're going to be okay. Just like I said, be aware of the short term. Once you start, short term increases are likely. So you're probably going to cause yourself a bit of discomfort, maybe more increased fatigue. But that should just be the short term. So I'm probably talking less than 6 weeks while you get accommodated to the program. If you're a healthcare professional, again, this gives you some reassurance and some confidence, especially if they've been signed off by the rheumatologist or a doctor to be able to start these exercise programs and increasing them to the recommended level of physical activity. So I hope that you found that useful. I certainly found this paper useful, and I will be delving into some more specifics and probably doing some more videos, maybe on actual prescription for people with lupus, to try and get some of my recommendations on how we might go about that. But some really good advice in there. If you do have any questions, thoughts, ideas, then please do comment them on the video. We're always keen to hear back from people. If you do want to read the full paper, then as I mentioned, it is in the description. It's free to access. Obviously, it's a medical journal, so if you're not that way inclined, it is a little bit heavy reading. But healthcare professionals, I do advise that you have a look at it as well. Really hoping that we will see some more specific research into this to see how people cope. Is there any better types of exercise, better amounts of exercise for people with lupus, especially around the fatigue aspect of it. And if anybody has any research in that direction they can point me to, I'd be delighted to read it. Or any people that are watching with lupus, let me know your experiences of exercise with this condition as well. Please do check out the other videos on the channel. Subscribe for updates as I release more. I've got some new types of videos coming I'm really excited about. Yeah, hit like. Why not? Hit like on it as well, and comment your thoughts. Till next time, I'll see you on some further videos. My name's Jack March, the Rheumatology Physio, and yeah, been delighted to make this video for you.